So we'll bring that down just to about there. So what I need you to do for me is just slowly slump forwards, just rest your elbows on your knees. And that feels okay? Good, okay. So we've got that flexion there, that's the position that we're going to need. Bring yourself back up, upright. So we're just trying to give general support for the low back. Obviously it's very non-specific. Perfect, there we go. So just take a little lean forward now and also bring your chin to your chest. Perfect. So we're going to go as low down as we can, PSIS, somewhere thereabouts. We're going to stay lateral to the spine and apply that under about 50% stretch because it's the only one that's going on. Anchor off under zero stretch. No creases. Distal anchor off. Zero stretch. Give it a little heat up. How are you in that position? Are you okay for another minute? Obviously flexion is the ideal, but if this is not a position that they can get themselves into without pain, then just try and do what you can. Lateral to the spine again. 50% stretch or just over. Bit of friction to activate the adhesive. Anchor points on zero stretch. And what that's hopefully going to do is maintain the stretch and the lift of those tissues when Ellie's back up in a neutral position. Okay, slowly. And if you go into that forward bend again for me, so just a bit of tension on the tissues, find the PSIS, just about there, and just about there. 50% stretch or more because it's a shorter strip. And what I will say, as you can see the tape peeling off, a little insider tip is antibacterial hand gel. It's the perfect kind of cleaner to make sure the tape will stick, to make sure it's dry afterwards. Because you always get people in clinic and they might have massage wax on them or they might be sweaty or anything like that. Okay, sit yourself back up. Good, so we can do, and this is improvisation now, QLs, so somewhere in there is going to be feeling a bit tender, yeah? Yeah, okay. So we've got last rib, 12th rib, iliac crest, that's the kind of place that we'll aim for. We'll cut to fit roughly that size. Can you side bend to the left for me, please? Any pain there at all?
I can feel it like stretching.
Okay. Last rib, iliac crest, somewhere in there is what we're aiming for. Good amount of stretch on the shorter eye strip. Apply the anchors with zero stretch. Straighten yourself back up. So what that's doing now, hopefully, because we applied it in a stretch position for Ellie, is that that's keeping the superficial tissues in that stretch, even when she's upright. Last rib. Well, that Q off is a lot tighter than the right. Is that right, or is that just me? Yeah. Okay, so somewhere about there is what we're aiming for. Side bend to the right for me, please. Anchors on the zero stretch. Heat it all up. Okay, and sit yourself back upright. It's a little bit wonky looking. That's kind of doing the job of what we want it to do. It might give a bit of short-term relief in the back pain, particularly QR related. How's it feel? A bit better with those on?
Yeah, good.
Okay, great. All right.